Good afternoon. My name is EMT Stoddard along with EMT Brown here. Today, we as EMTs attached to Jamaica Fire Brigade will be participating in a long case medical scenario assessment presentation. So today we got a call from family members about a male patient who was unresponsive at home. So upon arriving at the scene, we as EMS will ensure that the scene is safe to operate and the scene is safe to do so. We have BSI intact and all the necessary precautions are taken. We will also determine the number of patients. So far, one patient is what we have here. We will determine the nature of illness, which is difficulty breathing, and also we are not considering C-spine precautions at this time. We are also going to call ALS for immediate intercept en route. Alright? So upon approaching the patient, we formalize our general impressions of the patient. So we have a 20-something odd year old male patient lying supine in bed who seems to be having agonal gas or gasping for air, difficulty breathing. The patient doesn't seem to be responding to our presence. So we would move on to getting the patient's level of consciousness. So we move into the patient's line of sight. We have my partner. Sir, are you hearing me? No response from the patient. Pain. Patient groans to painful stimuli. And I would ask my partner to come around, open the patient's airway for me to assess the patient's airway. Right? So I would assess the patient's airway and I would realize the patient, after using the head tilt chin maneuver, the patient's airway is open. Right? So I would then move on to checking for the patient's breathing as well as attaching a pulse ox to the patient. Right? I will be looking, listening and feeling while checking the patient's carotid pulse. Patient has a pulse. The patient is not breathing. There's no oxygen moving in and out of his lungs. There's no chest rise and fall. So given that there's no chest rise and fall, the patient is not breathing, we're going to deal with this life threat immediately. So I will ask my partner, to get the oxygen ready while I get the necessary airway adjunct to maintain the patient's airway. Right? So I would measure the airway adjunct, and once we determine which one is the right size, we would use it by inserting the airway adjunct to the top of the patient's mouth, roof of the patient's mouth, and twisting it and ensure that it's secure in the patient. So my partner now will attach the BVM by giving positive pressure ventilation to the patient at 15 liters of oxygen, high flow, giving the patient one breath every 6 to 8 seconds. I will also have the suction on standby right over here, where my other partner would have prepared, and we'll also have the AED in the event that this patient loses a pulse and we have to begin chest compressions immediately. Right, so while my partner is bagging the patient and providing necessary oxygen, I would then move on to checking the patient's circulation, where I would then note that the patient is having note that the patient is having a respiratory SpO2 level of 75, right? And also we would move on now to checking the patient's circulation bilaterally, checking the patient's pulse, where I would realize the patient has a pulse of 104 beats per minute. The patient is cyanotic in all peripherals. The patient's skin temperature is warm to touch, right? And the patient is also dehydrated. You understand? So the patient is dehydrated, skin temperature warm to touch. I would now assume that think that the patient is going into shock, so I would treat for shock by covering this patient with a blanket to ensure that the patient his body temperature is maintained. So while my partner is continuous, I would continuously check the patient's pulse to ensure that the patient does still have a pulse, because if the patient loses a pulse, then we'll have to start compressions immediately, right? So this is a high priority patient for us, so we will be moving the patient to the back of the ambulance at this point. to load and go and wait for ALS intercept en route. In the ambulance now, I would do a history of the patient because one of the family members would have come with us, right? And I would ask the family members what the patient's history is like. So the signs and symptoms of this patient, it's pale, cyanotic, dehydrated. The patient, we were told, is allergic to augmentin. The patient is not on any medication at this time. The patient is, last known history is none. The patient doesn't have any past pertinent history. Last oral intake was 2 days ago, hence the dehydration, and the events leading up to this was that the patient was lying in bed. We would then move on to doing a set of baseline vitals for that patient. So the first thing I would do is to check the patient's pupil reactivity, right? And the patient has uneven pupils, right? We would also ensure that the patient is breathing. So I would go ahead and reassess the patient's check. The patient still has to regain breathing ability. The patient has no lung sound, no air moving out. We would then check the patient's SpO2 level still at, even with positive pressure ventilation going on same way, the patient still is at 75 to 80 on room air and O2 at 15 liters. We would then go ahead and check the patient's skin temperature, and the patient has a very high temperature of 102 degrees Fahrenheit. I would then ask my partner to do my other partner, while this one is still doing ventilation, I ask my other partner to do a GMR on that patient, while I go ahead and get a BP reading done for this patient. Alright, so this patient BP reading is 100 over 60, right? So given the fact that this is a high priority patient, we will continue reassessing that BP every 5 minutes, reassessing all the vitals every 5 minutes until we get a change. We'll also continue to assess the patient's pulse because it is very vital. The patient has not regained any breathing on their own. We're still applying positive pressure ventilation for this patient, and we are at the point now where ALS has intercepted. Now after ALS intercepted, they were able to apply an endotracheal tube to the patient, and therefore my partner now will still continue assisting them by bagging the patient with the tube now in, right, until we get to the medical facility where the patient would be handed over and the other issues are addressed with the patient being in an unconscious state. So that is our presentation for today. Thank you very much.